Hello everyone, welcome back to our channel. And today let us talk about an important health condition that affects millions of people worldwide. That is hypertension or high blood pressure. So as we have discussed, the theme for the year is controlling hypertension together. Check your blood pressure regularly and defeat the silent killer. This theme reminds us that controlling blood pressure is shared responsibility involving individuals, families, healthcare professionals, and communities. And hypertension is often called the silent killer because many people may not experience symptoms until serious complications develop. That is why awareness, prevention, and early detection are extremely important. So, what is hypertension? So, the blood pressure is the force exerted by the blood against the walls of our arteries. When this pressure remains consistently high, it is called hypertension, and the normal blood pressure is generally around 120 by 80 mmHg. And if it is 140, if it is 140 and beyond, then we call it as hypertension. So persistent readings above normal levels may increase the risk of health complications. So, we should understand why this hypertension or high blood pressure is dangerous. Because hypertension slowly damages the blood vessels and vital organs over the time. If it is uncontrolled, it can increase the risk of heart diseases, stroke, kidney disease, and even vision problems. And many individuals may feel completely normal even when their blood pressure is high, which is why regular screening is very much essential. So, now let's see what are the causes and what are the risk factors of hypertension. Several lifestyle factors and health factors actually contribute to hypertension. So these include excess salt intake, obesity, physical inactivity, stress levels, smoking, excess alcohol consumption, poor sleeping habits. Even if the person's family history is having hypertension, then it is also a risk factor. Diabetes and other metabolic disorders, and the list goes on. So some are the modifiable factors, some are non-modifiable factors. If there is a family history, that is not modifiable. But the modifiable factors like salt intake, obesity, physical activity, the stress levels, the smoking, alcohol consumption, sleeping patterns, all these are the modifiable factors. We can actually modify these factors so that we can prevent hypertension and we can manage hypertension. And unfortunately, the modern lifestyles with processed foods, sedentary habits, and chronic stress have significantly increased the prevalence of hypertension. So, here comes the role of nutrition in prevention and also in managing the blood pressure or hypertension. So there is a thing that like we can actually do some modification or the dietary modifications. For example, reducing excess salt intake. The recommended is 5 grams of salt per day. But if the individual is having hypertension, so if they can able to reduce it to 3 grams or 3.5 grams per day, the blood pressure can be reduced. Like it should be a consistent habit. So it can have an impact on the systolic part up to 5 to 7 mmHg. Like there is a study which shows that whenever the individuals are reducing their intake up to 3 grams, the systolic blood pressure has come down, like has decreased to like the difference of 3 to 7 mmHg.